going to the health sector. The Nigerian Medical Association in Rivers State says it has arrested one Ebbi Michael, who has been posing and practicing as a medical doctor in the state for over 2 years. The NMA, in a statement signed by the State Secretary, Dr. Hope Avunda, in Port Harcourt on Saturday, said Michael, a graduate of banking and finance from the Cross River State University of Technology, was nabbed by its anti-quackery committee. Avunda said the suspect fraudulently applied for the NMA River State identity card with fake documents, including a fake MBBS certificate from the University of Port Harcourt in 2017, a fake MDCN full registration certificate in 2023, which were found to be falsified. He added that Michael was arrested on Friday after a period of active surveillance when he appeared for an interview for the post of medical officer at the Port Harcourt Military Hospital, a place he has paraded himself as a staff member during his application for the NMA ID card. I want to meet Michael. I have a lot of questions because I don't get it. Anyways, the other questions I have will be directed at the NMA, who are responsible for holding on to Michael. But my guest is Dr. Ebbi Robinson. He is the chairman of the Nigerian Medical Association, the River State chapter. Welcome, Dr. Robinson.
Thank you very much for having me.
Yes, thanks for making the time. It's a pleasure. And apologies for the inconvenience of earlier. How does a person like Ebbi go undetected for quite some time? So I claim to be what I'm not, and I practice in whatever capacity. How do I successfully go under the radar for whatever length of time?
It depends on the individual.
Okay.
The individual's allies.
Okay.
Because someone cannot falsify such a very sensitive document without having some allies.
Okay.
Somehow. And the person must also, to an extent, have an understanding of how the health sector functions. So that means the person must be around the corridor of the health environment to be able to smuggle himself and then deceive people. But like we all say, you can only deceive people just for a while. At the end of the day, something which only make you to be exposed.
Has Ebbi been questioned? Because I'd like to pick his brains as to why, even though he's not certified, he went for, it's like impersonating a soldier and then going to the barracks to look for documents. It doesn't make any kind of sense. Has the enemy been able to get that information out of him?
We are as surprised as any other person. If we have the said person is a paramedic, that will make a lot of sense to every individual that, he is a paramedic and he is working within the health sector and can impersonate very easily. But having read banking and finance, coming to start impersonating as a doctor is it needs some level of psychological evaluation.
Indeed.
I sincerely tell you.
So what makes a person a real doctor?
Very clear. For you to be a medical doctor, registered to practice medicine and surgery in this country, you must have gone to medical school.
Okay.
A registered NUC accredited and Medical and Dental Council accredited medical school.
Okay.
After graduation, after 6 years, you must have done your 1 year compulsory housemanship. Now, after your 1 year compulsory housemanship, depending on your age, you can proceed to the youth service. But after your compulsory 1 year housemanship, you're certified and be given a full license to practice as a medical or dental practitioner in this country. Straightforward.
If you stop along the way, you do the 6 years or the 1 year, like you don't finish, you get very close. So you've acquired as much knowledge, but you don't get to the point where you are licensed. What should we call you?
You're not a doctor. You are not a doctor, and that is just the whole thing. I don't have any name to call you.
Isn't there anything on the way to doctor?
The university most times, like when I was in medical school, someone can still fail out of the medical school at the year 5, at the 5th year.
Yeah.
All right. Now, at that situation, the university usually graduate them with any of the paramedical, courses,
Okay.
like anatomy, physiology, at the case most times anatomy and physiology, which are some of our core courses. All right, because you have gone above that, so they just graduate you and they move on. And now some persons after that graduation still go back to university, start at year 2 and finish to become doctors. So if you do not finish, you do not finish. And there's nothing like a way to, or halfway to, or quarter way to, or attempted to. There is nothing like that. So it's quite clear. So if you don't finish, you don't have certification, and you can't practice. So it's criminal at that point to do whatever you do.
I understand, Dr. Robinson, that for medicine, it's one of those professions, those sectors that is so sensitive that there can be no nearly or almost. It has to be all the way because of how important it is. But I also know that if I were to take one thing from a practitioner, let's say you, for example, you're a doctor, of course, you're the NMA chairman, so there's no question to your credentials. And they say, let's dissect Dr. Robinson. Take one thing, his knowledge and experience or his certificate. I will take knowledge. That he has all the knowledge he has, but he's not certified, but he has his knowledge. I would obviously choose a Robinson, because we can't call you doctor if we're doing that has the knowledge, but he just did not get the certificate. Again, but there has to be a case for people who know but never got certified. Isn't there some window?
Honestly, the dynamism of medical practice does not completely anchor its activity on the similar knowledge you tend to have. Do you know why?
Tell me.
Because of the sensitivity of the profession. And when one person is lost to a family, a whole thing has happened. So anybody can stay outside the counter, across the counter, and sell drugs. But one day, he may give the wrong medication. Because there is dynamism in the profession. You must get to knowing everything you need to know as a doctor to be able to practice effectively. Therefore, I will choose a certification because that is the foundation of that knowledge. When the certification is not there, then I can also question you that is trying to assess him with his knowledge.
Is the certification process always thorough? You know how, somebody graduates from whatever and they say, well, you have the certificate, but we can't vouch for. With the corruption in many sectors, can you say that the certification process for health professionals, doctors in particular, is thorough for everyone who has it?
It's near thorough.
Okay.
There is no 100% in anything.
All right.
And even the examinations is not the true test of knowledge, as it were. Okay, so give and take, you can do some minus and plus, but anybody that is satisfied, as far as Nigerian universities are concerned, as far as Nigerian universities are concerned, most of the institutions, within the health sector, be it nurses, radiographers, pharmacists, I think the level of certification or the process of certification is near thorough. Because the examinations are not only based on what you write. We have other levels of examination. After the written, there are oral examinations. And there is a way you fail an oral examination, they will evoke your written examination and evaluate whether you really wrote it. So we have check and balances. And we also have in every of our exam, external examiners from other universities. So who certify your year 4 exam is not necessarily your teacher.
Oh my goodness.
So the Medical and Dental Council sends a supervisor to that institution to ensure that there is no form of malpractices. And so there are a lot of check and balances, especially medicine and surgery, in the context we are discussing. All
right, we have a break coming up. And coming up next, Dr. Robinson will answer important questions, but particularly, who has the responsibility of verification, the patient or the association? And how can you and I identify if our doctor is certified? Please stay with us.
If I tell you see all this plenty airtime and data, where they take flex? Now dash glow
Info Sam Oracle Chinedu here. I'm having conversations with Dr. Ebbi Robinson, the chairman, Nigeria Medical Association, River State Chapter. You're welcome once again, Dr. Robinson.
Thank you very much.
So we've been talking about what it takes to be certified a real doctor, and you've said the process is quite the process. You have to go all the way to be called doctor and to earn it. So my question is, who has the responsibility of verification? Is it the patient, me who needs treatment? Is it the association which you head? Who has the job of doing that?
Verification is the job of everyone.
Everyone.
Now, when I use the word everyone, that means the surveillance must be there by everyone. There must be high index of suspicion if the need arises. And but basically, for the sake of your question, it is the Medical and Dental Council and the Ministry of Health that has the statutory responsibility of verifying certificates.
Okay.
The Medical and Dental Council and the Ministry of Health and the Office of the Director of Medical Services under the Commissioner of Health. So that is the offices that has the statutory rights and privileges of verifying certificates. But medicine and medical practice as this way, everyone needs to be vigilant on who is the person administering medicine to me. In fact, the Medical and Dental Council will tell you these certificates are not meant to be in the box, especially the yearly practicing license.
Okay.
It's meant to be displayed where it could be very conspicuous for even patients to see. So when you walk into a consulting room, the practicing license of that doctor is meant to be conspicuous, especially if it's a private facility. In government facilities, it's very easy. Before you come into the government circle, you will be verified. Okay, completely verified. And therefore, the verification process for the government hospitals is quite clear. So if you apply to government offices, the verification process, because it's most times has something to do with the Ministry of Health, both state or federal, they easily verify with the agency and with the body that gives that certification.
All right.
So, as individuals, only prescriptions can make you raise your suspicion that is this a real doctor. So, information should come even from the public to the association when there's a suspicion of an individual's act. I've seen people calling me, I went to a clinic XYZ and the conduct of that person